Before you do anything else, take off your socks and look down at your feet for the next 30 seconds. What you're about to learn could be the difference between catching a serious condition while it's still whispering, or discovering it years from now, once it's already shouting. Most of us were taught to think of diabetes screening as something that happens through a blood draw, a number on a lab report that either crosses a threshold or doesn't. And that's true, eventually. But by the time that number shows up clearly out of range, the underlying process has usually been quietly underway for a lot longer than most people realize. The body has its own way of flagging trouble long before a lab test catches it. And one of the clearest places it does, that is somewhere almost nobody thinks to look. Here's something that surprises a lot of people the first time they hear it. Diabetes doesn't actually start out feeling like a sugar problem. In its early stages, it rarely announces itself with thirst, fatigue, or the classic symptoms most of us associate with high blood sugar. Instead, it often shows up quietly in the part of your body furthest from your heart, your feet. That's not a coincidence. Diabetes, at its core, is a disease of the blood vessels. It damages circulation slowly over months and years. And the smallest, most distant vessels in your body, the ones supplying your toes, heels, and the soles of your feet, tend to feel the effects first. Long before a standard checkup catches elevated blood sugar, your feet may already be sending out warning signals. The problem is, almost nobody has ever been taught what those signals look like. That's exactly what we're covering today. 9 specific changes that can show up on your feet well before a diagnosis, some of which you may have noticed already and simply chalked up to getting older. What? Stay with me through all 9, because a couple of these are so easy to overlook that even people who check their feet regularly tend to miss them. And the very last one is often sitting in plain sight, visible every single day, yet almost never connected to blood sugar at all. Let's start with the first one, sign 1, tingling or numbness that shows up without an obvious cause. Nearly everyone has experienced a foot falling asleep. After sitting cross-legged too long, that pins and needles rush when you finally stand up. That's completely normal and has nothing to do with what we're discussing here. What matters is whether this sensation is showing up regularly without an obvious trigger. At the breakfast table, lying in bed, walking to get the mail. If your feet are tingling on their own schedule with no pressure or position to explain it, that's worth paying attention to. Here's what's actually happening underneath the surface. When blood sugar stays elevated for extended periods, it gradually damages the protective coating that surrounds your nerve fibers. A helpful way to picture it, think of a nerve like an electrical wire, insulated in plastic. The insulation is what keeps the signal traveling cleanly from your foot to your brain. When that insulation wears down, the wire still technically works, but the signal gets distorted, and that distortion is what tingling and numbness actually feel like. This kind of nerve damage has a clinical name, peripheral neuropathy, and it's one of the most common long-term complications associated with diabetes, frequently starting in the feet before it's noticed anywhere else. It also tends to progress gradually and symmetrically, meaning it usually shows up in both feet around the same time, rather than favoring one side, which is actually a useful clue in distinguishing it from nerve issues caused by something more localized, like a pinched nerve in the back or an old injury. A simple, low-cost habit that supports nerve and circulatory health is a daily 20-minute walk. Not a jog, just a steady walk, combined with gradually reducing added sugar in your daily diet. Neither of these will reverse existing nerve damage overnight, but both help slow the process and give your body a better environment to manage blood sugar going forward. Sign 2, a burning sensation in the soles of your feet, particularly at night. This one has a sneaky pattern. During the day, when you're busy and distracted, you might not notice it at all. Then you lie down at night, the room goes quiet, and suddenly there's nothing to distract you from a warm, burning sensation across the bottoms of your feet. People describe it in different ways, like they walked barefoot across hot pavement or a low, persistent burn that simply won't let up. When a patient describes this pattern, it tends to raise a flag for clinicians, because nighttime burning in the feet is considered one of the earlier, more classic signs of diabetic nerve involvement. The nerves themselves have been affected by prolonged high blood sugar, and they begin misfiring, sending heat signals to the brain, even though nothing hot is actually touching the skin. It's a bit like a smoke detector with a faulty sensor. The building isn't on fire, but the alarm keeps going off anyway because the sensor itself has been damaged. This kind of nerve-related burning can appear well before blood sugar levels are ever formally tested, which is exactly why it's worth taking seriously rather than dismissing as just poor circulation or getting older. What makes it particularly easy to miss is that it doesn't fit the mental picture most people have of a warning sign. There's no visible mark, no injury, nothing you could point to and show a doctor. It's purely a sensation, which makes it easy to talk yourself out of mentioning it all. That's worth pushing past, because a sensation-only symptom is still a symptom. 2 practical habits that support this: staying consistently hydrated throughout the day and adding a source of fiber, vegetables, oats, legumes, to each meal. Fiber slows the rate at which sugar enters your bloodstream, which reduces the spikes that place ongoing stress on already sensitive nerves. Sign 3, cuts, blisters, or small wounds that simply won't close. This is the point where the issue stops being merely uncomfortable and starts becoming genuinely dangerous. It's an extremely common story. Someone develops a small blister from a new pair of shoes, assumes it will heal on its own within a week the way it always has, and 3 weeks later, it's still open. In a healthy body, a minor cut or blister typically closes within about 5 to 7 days. But when blood sugar runs consistently high over time, the small blood vessels responsible for delivering oxygen, nutrients, and immune cells to the skin become stiffer and narrower. Picture trying to water a garden through a kinked hose. The water is technically still available, it just isn't reaching where it needs to go fast enough. The result is a wound that lingers far longer than it should, and lingering wounds are far more vulnerable to infection. This is a genuinely serious issue. Foot ulcers that fail to heal properly are one of the leading causes of lower limb amputation in people with diabetes, and in the vast majority of cases, they started out as something small and seemingly minor that simply didn't get attention in time. What makes this particularly frustrating is how preventable it usually is. The wound itself often isn't the dangerous part. It's the delay. Days turn into weeks, weeks turn into a genuine infection, and by the time it's taken seriously, the options for treating it have narrowed considerably. That's why the standard advice among foot care specialists isn't complicated at all. Catch it small, treat it early, and don't assume it'll heal on its own the way it might have when you were younger. A simple nightly habit can make a real difference here. After your shower, sit down with good lighting and check both feet carefully, including between the toes and underneath the heels. Areas that are easy to overlook simply because you can't see them without deliberately looking. If you notice any cut, blister, or open area, clean it gently with soap and water. Apply a basic antibiotic ointment and keep it covered. If it hasn't visibly improved within about 48 hours, that's the point to call your doctor, rather than continuing to wait it out. We've covered 3 signs so far, and there are 6 more to go, including one that shows up in a place almost nobody thinks to check, and one that's often mistaken for a completely unrelated problem for years before anyone connects it back to blood sugar. Keep going, because the next section covers some of the changes that are the easiest to dismiss as just aging, until you understand what's actually causing them. Let's continue right where we left off, with a change that hides in plain sight. Quite literally, right on the skin of your lower legs. Sign 4, darkening or discoloration on the skin of the lower legs and feet. This is one of those changes that's easy to notice and just as easy to explain away. You glance down in the shower and notice your shins or ankles look a little darker, a little reddish, almost bruised, even though you haven't bumped into anything. Most people assume it's just how their skin has always looked, or a natural part of aging. Sometimes that's true, but there's a specific recognizable pattern of skin discoloration on the lower legs that's associated with long-term blood sugar elevation, sometimes referred to as diabetic dermopathy. When the small blood vessels feeding the skin in this area are damaged over time, that tissue doesn't receive quite enough fresh oxygenated blood, and the skin gradually changes in appearance. Darker patches, a reddish or slightly bluish tint, and skin that becomes thinner and bruises more easily than it used to. These changes can appear well before blood sugar is ever formally tested, which is part of why they're so often missed. It's also worth noting that this particular sign is sometimes confused with ordinary bruising, or with skin changes related to varicose veins. So it's not a diagnosis on its own, just one more piece of information worth mentioning to a doctor if you notice it alongside any of the other signs on this list. A simple daily habit that supports circulation here is a few minutes of ankle circles, gentle toe raises, and light calf stretches first thing in the morning before you even put weight on your feet. It's a small amount of movement, but it helps encourage fresh blood flow into the lower legs right at the start of the day. Before we move to the next sign, it's worth pausing for a moment. If you've noticed even one of the first few things we've covered so far, that's worth sitting with. Not to panic, but simply to pay attention. Awareness is the entire point of this video. Sign 5. Heels that crack, split, and refuse to heal no matter how much lotion you use. Cracked heels are extremely common as people get older, and on their own, they're rarely a red flag. But there's a difference between ordinary dry skin cracking and heels that split deeply, persistently, and don't respond to moisturizer no matter how often or how generously it's applied, even during humid summer months when dry skin usually isn't an issue. The explanation involves a different set of nerves than the ones we discussed earlier, the autonomic nerves, which control automatic bodily functions you never consciously think about, including the sweat glands in your feet that keep the skin naturally moisturized from the inside. When prolonged high blood sugar damages these autonomic nerve fibers, that internal moisture supply gets disrupted. No topical lotion can fully replace what's being lost internally, which is why the cracking often persists regardless of how much cream is applied. This matters beyond simple appearance, too. Deep cracks in the skin function as open entry points for bacteria, and in feet where circulation is already compromised, an infection that starts in a small crack can progress far more quickly than it would elsewhere on the body. A consistent nightly habit helps here. Moisturize the soles and heels thoroughly before bed. Coconut oil or a good thick lotion both work well, but avoid applying it directly between the toes, since trapped moisture in that area can actually encourage fungal growth. Staying well hydrated throughout the day also supports skin health from the inside, not just the outside. If you've been diligently moisturizing for weeks with no real improvement, that persistence itself is actually useful information. It tells you the issue likely isn't simply dry skin in the ordinary sense, and it's a reasonable thing to bring up at your next doctor's visit rather than continuing to cycle through different lotions and creams, hoping one will finally work. Sign 6, persistent swelling in the feet and ankles. A little swelling now and then is completely normal. A long flight, a full day standing at a family event, and your ankles might puff up temporarily, then return to normal by the next morning. What we're talking about here is different. Swelling that shows up nearly every evening, swelling that leaves visible sock marks pressed into your skin, or swelling that's still present when you wake up rather than resolving overnight. When blood sugar remains elevated over a long period, it can gradually affect kidney function, and one of the kidney's primary jobs is regulating how much fluid your body retains. When that regulation is disrupted, excess fluid tends to pool in the lowest parts of the body due to gravity, typically the ankles and feet. There's a simple way to check this at home. Press a finger gently into a swollen ankle, hold for about 5 seconds, then release. If the indentation lingers for several seconds before slowly bouncing back, that's known as pitting edema, and it's worth mentioning to your doctor. Kidney-related complications are a well-documented long-term risk associated with diabetes, and visible lower leg swelling is often one of the earliest outward signs that something in that system needs attention. A couple of simple habits can help in the meantime. Elevate your feet for around 15 minutes a few times throughout the day, particularly in the evening. Even a couple of pillows under your feet is enough to encourage fluid to drain back toward your heart. And pay closer attention to sodium on nutrition labels, since salt encourages your body to retain water, and it's hiding in far more processed foods than most people realize, including things that don't taste especially salty, like bread, canned soups, and packaged sauces. It's worth adding a bit of nuance here, because swelling has plenty of other, less concerning causes too. Certain blood pressure medications, prolonged sitting, warm weather, or simply spending more time on your feet than usual can all cause temporary puffiness. The distinguishing feature to watch for isn't swelling itself, but swelling that's become a consistent, near-daily pattern rather than an occasional response to a specific day's activity. Sign 7, sharp, stabbing, or electric shock-like pain in the feet, especially at night. This is one of the most frequently misunderstood signs on this entire list, largely because it mimics other, more familiar conditions. It's common for someone to manage this kind of pain with over-the-counter pain relievers for months, assuming it's arthritis or an old lingering injury, and sometimes that assumption is correct. But sometimes the pain has nothing to do with joints or old injuries at all. When nerves are damaged by prolonged, elevated blood sugar, they don't always go numb. Sometimes they do the opposite, becoming overactive and firing sudden, intense pain signals into the brain without any actual physical trigger. People describe it as a stabbing sensation, a hot needle, or a jolt of electricity that seems to come out of nowhere, often worse at night when the body is still and there are fewer distractions. Over-the-counter pain relievers can dull this temporarily, but they don't address nerve damage itself, and relying on them long-term carries its own risks worth discussing with a doctor, particularly for cardiovascular and kidney health. This is exactly the kind of pain that deserves a real conversation with a doctor, rather than months of quietly managing it alone. Not because the pain itself is dangerous, but because chasing the symptom without addressing the underlying cause tends to mean the pain simply keeps coming back, month after month, while the actual issue continues unaddressed. A simple daily habit that can help. Before standing up in the morning, spend a few minutes doing gentle foot stretches while still in bed, flexing your feet up and down, circling your ankles, gently pulling your toes back, to get some circulation moving before your feet bear any weight. We're 2/3 of the way through the list now, and the final 2 signs are, in many ways, the most overlooked of all. One of them is something almost nobody brings up on their own. It usually takes someone else pointing it out before they even notice it themselves. Stick around for the last part, because it also brings everything together into one clear, practical plan you can actually use tonight. Let's finish the list with the 2 signs that tend to fly under the radar the most, and then bring everything together into something you can actually act on today. Sign 8, feet that stay cold no matter what you do. Everyone's feet get cold sometimes. A cold tile floor first thing in the morning, a chilly winter evening, that's just life. What's worth paying closer attention to is feet that stay cold consistently, regardless of the season. Cold in the middle of summer, cold under layers of blankets, cold while the rest of your body feels perfectly warm. That pattern tells a very different story than ordinary seasonal chill. Persistently cold feet that don't respond to warming are one of the clearer indicators of reduced blood flow, sometimes related to a condition called peripheral artery disease, where the blood vessels supplying the legs and feet have narrowed over time, frequently linked to long-term elevated blood sugar. A helpful way to picture it, think of your circulatory system like the heating pipes running through a large house. If those pipes narrow somewhere along the line, the room furthest from the furnace stays cold, no matter how hard the furnace itself is working. Peripheral artery disease is a widely recognized condition, and diabetes is one of its most significant risk factors. It's also a condition that tends to develop quietly over a long period, without any dramatic single moment where you'd notice something is wrong, which is exactly why persistent cold feet are worth paying attention to rather than writing off as just poor circulation or just getting older, phrases that, ironically, are often used to describe the very thing worth investigating. One of the most effective things you can do to support circulation here is a brisk daily walk of around 30 minutes. Arms swinging a real pace, not a casual stroll. If that feels like too much right away, even starting with 10 minutes and building up gradually still helps push blood into the lower legs and, over time, can support healthier vessel function. Sign 9, thinning or complete loss of hair on the lower legs and tops of the feet. This is the sign that's almost never brought up voluntarily. It typically only comes to light when someone happens to compare the hair on their lower legs to the hair on their thighs and notices a stark difference. Or when it's pointed out during a routine physical exam, followed by a surprised, I never noticed that before. Hair follicles, small as they are, require a steady, reliable supply of blood and oxygen to keep functioning normally. When circulation to the lower legs has been gradually reduced over years of elevated blood sugar, those follicles slowly stop receiving what they need. And hair growth in that area gradually slows and eventually stops altogether. The result is skin on the lower legs and feet that looks noticeably smoother and more hairless. Compared to the rest of the leg, a quiet, visible marker of blood vessel changes that have likely been developing beneath the surface for a long time. This pattern is a recognized physical indicator that clinicians are trained to look for when assessing circulatory health in the lower limbs. If you check tonight and notice thinning or absent hair on your lower legs, particularly alongside any of the other signs we've covered, it's a reasonable prompt to schedule a simple fasting glucose or A1C blood test in the near future. Not something to put off indefinitely. It's an inexpensive, widely available test, and for many people, it's covered under standard insurance or Medicare benefits. A single blood draw can provide clarity that months of guessing never will. What makes this particular sign so easy to overlook is that hair loss in general gets attributed to almost anything except blood sugar. Genetics, aging, even the type of razor someone uses. Nobody's first instinct, looking at smoother than expected shins, is to think about their pancreas. But that's exactly why it's worth including on this list. The signs that are hardest to connect to diabetes are often the ones that carry the most useful information, precisely because nobody else is likely to point them out to you. Let's bring the full list together. Tingling or numbness without a clear cause, burning across the soles of the feet, especially at night. Cuts or small wounds that take far longer than they should to heal. Darkening or discoloration on the lower legs. Heels that crack and split no matter how much lotion is used. Persistent swelling in the feet and ankles. Sharp, stabbing, or electric shock-like pain, particularly at night. Feet that stay cold regardless of the season. And thinning or absent hair on the lower legs and feet. Each one of these, on its own, might seem minor enough to dismiss, but taken together, they form a pattern. Your body's early warning system often active, years before a routine blood test would catch anything unusual. None of them require expensive equipment or a specialist to check. All they require is a few minutes of your attention. So here's what I genuinely encourage you to do tonight, just one simple thing. Sit down somewhere with good lighting, take off your socks, and spend 30 seconds looking at both feet. Check between the toes, look closely at your heels, run a fingertip along the skin to check for numbness. Notice the color of your ankles and lower legs. If even one of the 9 signs we covered today sounds familiar, consider reaching out to your doctor in the near future and asking about a fasting glucose test and an A1C test. Both are simple, standard, and widely available. Catching something like this early tends to make an enormous difference in how manageable it is. In many cases, early changes in diet, regular movement, and an honest conversation with your doctor are enough to meaningfully shift the trajectory before things progress further. You've spent years building the life, the independence, and the energy you currently have. It's worth protecting that with a little bit of attention now, especially when the information needed to act is this accessible. None of the 9 signs we covered today require special equipment, a referral, or a specialist appointment to check for. They just require you to actually look, something most of us rarely do beyond a quick glance while putting on socks in the morning. That's really the whole point of a video like this one. Not to introduce anything complicated, but to hand you a short list of things worth noticing, so that if your body has been trying to tell you something, you're finally in a position to hear it. If this video gave you something useful, consider sharing it with someone in your life who's over 50, a parent, a spouse, a sibling, a friend. It might contain exactly the piece of information they've never been told. And if you'd like more clear, practical health information like this going forward, subscribing helps make sure you don't miss it. A quick note before you go, everything covered in this video is general health education based on widely recognized medical concepts. It isn't a substitute for personalized medical advice, and everyone's situation is different. Please speak with your own doctor before making any changes to your diet, medications, or daily routine, especially if you're managing an existing health condition. Take care of those feet. They've been trying to tell you something all along.